Thank you, Aaron. Well, it was very interesting in Mexico to analyze this information about malaria and the conversation that is happening in social media. It was actually very sad to see that this conversation is very low in a country where the prevalence of malaria is so high. There are many reasons for this. One, I believe, is that actually what Aaron and Anthony were saying, the conversation and the information is not being sourced from the people that have the knowledge. In Mexico, only 5%, for instance, of Twitter accounts come from companies and from educational institutions. This is a very low number if you realize that more than 90% of the conversation are from individuals, and not all of them have the knowledge to have this information flowing. And also, I believe that an important figure of demographics is that as a lot of things in Mexico, social media is centralized in the three bigger cities, which are Mexico City, Guadalajara, and Monterrey. And 87% of the conversation comes from these places. And malaria is more prevalent in the southeast of the country. So that's an interesting thing we have to consider. So, as Aaron and Anthony were saying, I believe that social media is a very fundamental ingredient on any communication campaign. And in a malaria communication strategy, we could put in Mexico. As they were saying, traditional media, because of the demographics, would have to be the key ingredients. But still, social media would have to be considered in order to really pour this mix of information, of quality and engagement. And this would be accomplished if we could really get local testimonies and stories that would make the engagement possible. And in this regard, we could really pour in the education that is needed to prevent such an important disease.
So that brings us to the end of the kind of presentation part of the section. Us pushing at you, and we're soon going to want to have a dialogue. But I'm going to hand over to Neil just to wrap up on the slide deck, and then he's going to also facilitate the Q&A session.
So I promise I wasn't actually just doing my emails all the way through the presentation. So I've been listening to what people have been asking a few questions on the live stream, and also on Twitter there's some questions coming. So I've got some questions to kick us off, and just if people are listening in or in the room, start thinking of questions and we can get a good dialogue going, that would be great. So in terms of digital and malaria, I'm not sure what maybe we'll find out in the Q&A, but we were expecting to see a bigger impact from World Malaria Day in the social media space. So we just identified that there are some real challenges and opportunities for institutions in the space, and it's really important to understand the audience that you're trying to speak to, and that there really is an enormous opportunity out there, we believe, for someone to lead this discussion and this debate in the social media space. There's a huge opportunity. There's an appetite for it, and I think that could be fed. World Malaria Day didn't impact, it had an impact, but maybe not as hard as we thought it would be. And if World Malaria Day organisers are listening, they should give us a call, because we'd like to use our insights to see if we could help them with 2012. And basically, malaria needs to be given that personal relevance to really lock into people, so that it's something that they want to engage with, they want to share with their friends and their family. So we believe, as a network, that we are at a tipping point when it comes to health and social media, and that we are in a good, strong position as experts in both social media and health to really help our clients with the use of our social framework to help them listen, interpret, and inform what they're doing in the social media space, but also looking to making sure that our communications are integrated, so that traditional is also factored into the mix, and our engaging propositions we can create can work in additional channels beyond the social ones. So, I have, what I'll do is, if I can kick off with some questions from the people out there listening. So, this is a kind of technical one, which I think is an Anthony question. In particular, Aaron could probably do it, but we'll sling it to Anthony first. Christian Liu has asked on Twitter, how can we stop blog tweet bot invasion? Yeah. What is it? I'll teach you to explain what it is and then how we stop it.
Well, this idea of blog tweet invasion is a lot of what we were talking about before. When an automated blog post goes up, there's automated tweets that often follow that blog post, and it's like, hey, new blog post, and it just pulls out the subject line. From a technical standpoint, we can all be vigilant users of social media and actually mark these people as spam. But we have to be careful of that because our news sources do use this as a tool to push information out. But if it's non-relative spam, like Viagra spam or UK lottery spam, which is another great one that I love getting across my Twitter feed, that you can actually go into Twitter and mark those people as spammers through the service. And also services like TweetDeck have that built into TweetDeck, where you can hit one button and start logging them as spam. And if we all do that, that will start to filter out sort of that spam culture. The other point to that is just do research. If you don't follow these people and you don't give them an excuse to put their information up, they'll be less likely to do it.
Okay. What was the positive use of it?
News sources like CNN, Fox News, lots of actual blogs that push out news content will put on their sources that they put out a new post or a new news source. But you enter that agreement with them to understand that's what they're doing. If you follow CNN.com, it's most likely going to be news posts and breaking news, and then every now and then, some more personal information.
I suppose that's why you also need experts who are looking at the data, not just because you can produce some really great charts and graphs from that. Those sort of automated services, which make you think you've had a super duper impact, but as soon as obviously you scratch the surface, start looking at the data, that's when you see that it's maybe not what it looks like.
And then it really comes to, if you want to push out information like that yourself, having a good writer who understands how to use Twitter and write is actually a unique skill. It's probably, you have to be a high-level writer to actually write well on Twitter, because you need to find ways to be as concise as possible and use colloquialisms, which are local dialect pieces, to really engage your users. So a great writer in the US would not be a great writer in the UK because the colloquialisms are completely different. I would not be able to inhibit an emotional response on a word because I'm just not familiar with the culture. And it goes on and on across all different networks.
Just like to add on to that, with Fox or BBC or whoever, what you're signing up to, their engaging proposition is that they are going to have breaking news, so you don't mind them kind of spamming you with a news alert which isn't too personalised, because that's what you're buying into, that's what you've opted for. Other organisations who don't have the same value proposition that a news organisation has need to be really cautious with planning their social media, because if they go out in the first place with just kind of spewing out content, then they're going to turn off the community from the outset, and then you put yourself on a significant back foot, which is hard to overcome.
Great. Sorry. Okay. Ace Sellers asked on the live stream, what role is mobile playing in the health-focused social media landscape across the globe?
Well, I'll start off and then I'll pass to Aaron. A great thing that I've heard that mobile has been used as is it's innovative. The access to a mobile phone is basically the access to the world now, especially in developing nations in sub-Saharan Africa. It's cheaper to build a radio tower to get a cell phone network working than it is to run landlines in Saharan Africa. So what they're doing is they're building up many of these towers and giving doctors in the field mobile phone kits that they can actually use to put health information back to people that have better research data. And the most innovative thing I've seen, I heard about 6 months ago, was our infrared mouses that we use are actually the same bandwidth scope that electronic microscopes use when they analyze blood. So a startup company in Africa built a box that you can hook up a camera phone to with the LED display or the laser display from a mouse, put a cell of blood on a slide in between the phone and the mouse, take a picture of that, and then email that to a doctor in a research lab, and that information can actually be used to diagnose things like malaria and other blood diseases.
I think we have to be cautious when it comes to mobile and health. The type of thing that Anthony's just discussed there is potentially a useful tool and potentially addresses an unmet need. But when we're getting to that level of complexity, we're bordering on medical device territory, and who are the people producing these? What is the credibility for the application? So I know this is something being considered at a regulatory level. I'm also aware that the pharmaceutical industry is looking at how apps can be developed alongside clinical trials to be robust, to add value to patient adherence, and to be genuinely credible healthcare tools. I think they're one thing. I think fun, silly little apps that can maybe stimulate disease awareness campaigns are another thing. I think they both have their place, but I think we have to be very careful if we're starting to move ourselves into a diagnostic territory.
Right. So, do we have any questions from anyone in the room?
Early in the presentation, you talked about individuals who blog regularly or post as becoming quote-unquote experts. However, there's a risk in that sense that that contributes or could contribute to the spread of inaccurate information, rumor, and in effect create a situation where you're putting out information that's being responded to that you really don't want, it's really just not correct. And I can think of one or two examples, but just in general, how do you correlate that issue with authenticity issue?
I'll take that off the bat. If we go up, you can tell I've been in America for 2 days, take it off the bat. If we think to what Paola discussed, in Mexico, so a country that has high prevalence, and the lack of information being given by the institutions that can provide it, I think what we need to look at for social media and patient experts is how they can be engaged with and stimulated to then use and share content which is credible and robust in the first place. So if we go back to what we said our values were for social media engagement for healthcare, understanding, listening, finding out the dialogue first of all, and then thinking how you can go and talk to these people and get them involved from the outset. What happens with social media is communities self-regulate. So what you're looking to do is to build, I don't even think patient experts is the right term, but to build people who have something vocal to say, who share information which has come from credible sources and basically endorse to their friends, yes, this is good, no, this is not good. That's the outcome you're looking for. To get there, you have to be collaborative from the start, and you have to provide lots of rich content. You have to be generous. And like we said, be proud of what you can bring to the table. So just go and have a conversation and then start that relationship. If you approach it like that, then it will self-regulate. And we see that. We see that in the UK with a number of Facebook groups which are being simulated by the pharma industry. They naturally self-regulate themselves, and the kind of outlying patients are kind of rejected from the community by the bulk of the people. One last point to it, we have patient experts in terms of information transfer. We have patient experts of sharing understanding of the disease. So I don't have certain diseases, you don't have certain diseases, you have no idea what their world is like. There is absolute value in them communicating with their peers and sharing coping mechanisms. So that should be encouraged and not viewed as something scary from the outset.